Welcome to Silicon Slopes. I'm Brittany Graham, and I'm going to be moderating the panel today. We are going to be talking about MedTech for today's town hall. These three have totally different companies, and they all have so many different skill sets. So we're going to start with the challenges in healthcare right now, because each of you are dealing with different challenges.
There's a statistic that a lot of folks out here will know that it costs $1 billion or more to bring a new drug to market, and the reasons for that is not that individual drug costs so much. It's because there were probably 50 to 100 drugs that failed out before that, either in discovery or in development. The thing that we're really trying to work on is how to bring down that cost by making it more effective. By doing discovery more effectively, doing things that can treat diseases more effectively, and are less likely to fail out in the clinic, so we can actually get treatments to patients more quickly and more cheaply than you can in the present day.
Biggest problems to me are that we spend $3.5 trillion in the United States a year on healthcare. We've got lagging quality relative to cost. And there are a bunch of different ways, and I think all three of our companies tackled this problem. But we're at Collective very focused on how do you eliminate that $1 trillion of cost? And we're particularly focused, or $1 trillion of waste, and we're particularly focused on $260 billion of that waste that generates medically unnecessary workup, outcomes, visits that could be totally avoided through better coordination.
You've got the biggest industry in the United States, right? Over 20% of the GDP. And historically, you've got disengaged consumers. So you have this issue where the people that are consuming the goods and services for the last 80 years haven't had to pay for it. The biggest problem that's driven a lot of this waste is disengaged consumers, disengaged providers. I practiced for 12 years as a general surgeon, and I'm telling you, there's this kind of detente between consumers and their doctors, where it's like, how can we screw the insurance company who just wants to screw both of us?
Well, disengaged doctors, right? Like, as a surgeon, did you know what your surgeries cost or what your
I had no idea, but I will tell you probably probably the most remarkable low-tech solution to telling us what cost was as a surgeon, we have these gloves we have to wear, right? And some of them cost 45 cents and other ones cost $10. And there's times when you're like in someone's belly and it's full of shrapnel, you probably want the $10 gloves. But most of the procedures now are done laparoscopically, and the 45-cent ones are probably better because they're thinner and they're easier to move your hands in. And all someone did, this was low tech, was took a glove and put it on a piece of cardboard, each glove, and wrote the price in magic marker of what the cost was and stuck it up on the wall of the OR. And doctors were like, are you kidding me? We had no transparency. So I think disengaged doctors, disengaged consumers, third-party payer systems is the biggest problem that's driven a lot of the waste and challenges we've talked about.
One of the key things that we're doing is we're actually trying to build systems that are closer to reality. So actually doing our drug testing, for example, in cultured human cells with models that more accurately represent the diseases involved, so there's less chance of a failure for efficacy or for translation downstream. And then beyond that, the way that we're doing this actually makes use of computer vision, machine learning, and AI to address some of that challenge, in that we don't know all of the biology that's happening.
I go to a new emergency department, a new facility, and they run a new CT scan, a new MRI, they run more tests. They're not talking to each other. That's waste. I get discharged from a hospital, but my primary care provider doesn't realize it, and I need some home health, but they don't realize I got discharged. And so I have a complication. I can't self-navigate. I end up readmitting back to the hospital. That's what we're tackling. Our focus is imminent risk. But that's the problem. How do you help every single stakeholder across the healthcare continuum, even though they represent different organizations, they've never met one another, they may even be competitors with one another, but unite around the patient because they share one thing in common, which is a common stewardship for that patient, so that they can render care as a single coordinated healthcare team. Data does not belong to our companies. Healthcare data does not belong to providers. It does not belong to payers. It belongs to the patient, and it must follow the patient wherever the patient goes.
So how many of you have a health savings account? All right, the rest of you need to get one. So what my folks do is they take money out of their 401k every year. They immediately take about a third of that money they take out, send it to the IRS, because they're being taxed on that money, and then they use the balance to pay for their out-of-pocket healthcare expenses. If you take it out of an HSA, Newsflash, you don't send the money to the IRS. $20 copay, and you get the world, drives way high expenses, and I think it contributes to some of that $1 trillion of ill-spent money.
Let's talk about some of the pitfalls of healthcare. You guys have addressed a couple of them, but also just the need for education in this space, because like you said, a lot of just your average person doesn't know what they're dealing with and what the possibilities are.
The work that we do, even very upstream on the discovery end of things, not only does it contribute to, getting therapies out there, getting it there cheaper, which is the goal that all of us have, but it actually broadens the scope of access that we can have, right? There are treatments that, without the technology that we're working on at Recursion, simply would be uneconomical to develop treatments for. And I think, big reasons for that are the ability to, amortize your technology build costs. Like, this is an extremely expensive business with a lot of upfront costs to get into, but the way that traditional pharma does it, you're almost having to replicate a new stack for every new therapeutic area or every new drug you want to get into. By leveraging the power of machine learning and computer vision, we're able to generalize that across a lot of different therapeutic areas, and by doing that, really hope to be able to address that long tail of human disease.
So the stakes matter. Getting it right matters. The data we have is on a much greater population and is far more sensitive than social security numbers and addresses and the occasional driver's license. And so, of necessity, you have to move slowly, you have to invest extra, you have to get it right, you can't screw up. It's not okay to just break things and move on.
Okay, so what keeps me up at night a little bit is that all we need to do is unleash the power of consumerism and transparency and consumer incentives, and then make the systems respond to the consumers just like our other industries do. So we're on the cusp of making this work. I just hope that we're not dropping into some sort of Medicare for all scenario, because I do think it would kill innovation.
I totally agree, by the way. We're talking about like the problems and the impediments. Mm-hmm. There is like a happy story to this, and there is like a clear path to a happy ending for this industry, which is, a bunch of the issues we've talked about. Mm-hmm. Like, the country gets it.
Yeah.
People actually want a good outcome. Physicians and nurses and case managers and social workers are good people. Like, I've long believed that bad people don't go into healthcare. There are big inertial mechanisms in place that are fixing these problems. And so I'm optimistic, I'm hopeful.
Let's give them a big round of applause.